to our participants in this PPS webinar. It is my honor to be your resource speaker for this important topic, which will give you answers on the question, what can be done or what are the nutrition actions that can be done in mitigating COVID-19 related effects from the perspective of the government sector. To continue, allow me to emphasize that I have two major key points to discuss. First, the role of the government in mitigating COVID-19 related effects on the nutrition of Filipino children. Second, current programs and responses to COVID-19 related under or overnutrition. Now, the first role of the government and response is to prevent the increase or worsening of wasting among children. And our program for this is the Philippine Integrated Management of Acute Malnutrition, or PMAM. The Philippine Integrated Management of Acute Malnutrition, or PMAM, of the Department of Health is one of the programs that is considered as a response to COVID-19 related effects. This program is recognized by UNICEF and WHO as the only established evidence-based intervention which successfully addresses the problem of acute malnutrition. It involves capacity building of local implementers and provision of services to acute malnutrition, the SAM and the MAM cases, both under routine health program and during emergencies. Here are the outcome targets for PMAM. First, at least 50% of the MAM and the SAM cases are identified and enrolled in inpatient or outpatient therapeutic care. Second, at least 75% of both the MAM and the SAM cases are cured. Now, the 2021 FHSIS registered a total of 58,022 moderately acute malnutrition with 23,350 or 14.24% admitted in the Supplementary Feeding Program or the SFP. Of those admitted, 6,179 or 26.46% were cured and 374 defaulted with 21 or 0.09% died. For severe acute malnutrition or the SAM, a total of 19,450 was recorded with 5,197 or 26.71% admitted in outpatient therapeutic care or the OTC. Now, of those admitted, 32.27% were cured, 19.36% defaulted, and 40 or 0.77% died. As we all know, it is important to identify and locate the children with MAM and SAM. For this, the NSC procured and distributed mid-upper arm circumference or MUAC tapes for nutrition assessment to selected regions. The PMAM working group, being led by DOH, will focus on these three strategies. First, under policy development and implementation, the PhilHealth package for some cases was developed in December of 2019 and was already approved by the PhilHealth Board for pilot testing this year, 2022. Now, in terms of service delivery, the DOH is currently monitoring and ensuring the increase in the number of PPAT priority provinces, cities, and municipalities that are able to provide inpatient as well as outpatient therapeutic care for severely and moderately acute or wasted malnourished children. Third, the Department of Health is also conducting PMAM trainings for hospital and health and nutrition staff to develop their competencies to identify, treat, and manage acute malnutrition, as well as deliver quality services both under routine health program and during emergencies. Virtual and blended trainings on simplified approach to manage acute malnutrition was also conducted and conducted in pilot trainings on family, MIWAC capacitating mothers to measure the progress of their children during the pandemic. Fourth, bottleneck analysis was also done in 15 priority provinces in 2021 and was also provided trainings on supervision to ensure the delivery of quality service in the context of this COVID-19 pandemic. As it was recognized that we have a lot to deal with micronutrient deficiency, especially among children, this role should never be neglected by the government and continue to be supported as response to mitigate effects of COVID-19. One of the nutrition-specific programs under the Philippine Plan of Action for Nutrition for under 5 children is actually micronutrient supplementation. It is the provision of pharmaceutically prepared vitamins and minerals such as vitamin A, iron folic acid, zinc, and micronutrient powder for the treatment or prevention of specific micronutrient deficiency to complement sustainable food-based approaches such as food fortification and diet diversity. This program actually focuses on pregnant and lactating women, women of reproductive age, including adolescents and children aged 6 to 59 months, as these are the groups most vulnerable to micronutrient deficiencies and their consequences. Our target by 2022 under the PPAN is to reduce micronutrient deficiencies of children under 5 years old to levels below public health significance. This is another role that the government should take the lead. However, based on the results of the expanded National Nutrition Survey of the OST-FNRI, both vitamin A deficiency and anemia remain a moderate public health concern among 6 months to 5 years old children, based on WHO cut-off points. Now, on the provision of vitamin A capsules and micronutrient powder, we are actually targeting to reach at least 19% of the children 6 to 59 months old. And based on the FHSIS field reports from DOH 2019, we were able to meet only the target of vitamin A supplementation of 6 to 11 months children. The DOH, as the lead agency of this program, will work together with other partners at the national and local levels in taking the following next steps. First, there should be electronic logistic information system, or the ELIS software, which is expected to be operationalized by 2022. The system can track the incoming and outgoing commodities in the DOH warehouses and can also generate real-time inventory to prevent slow movement of commodities and their expiration while in storage. Guidelines on the inclusion of micronutrient supplements under primary health care packages of PhilHealth will be drafted in compliance with the Universal Health Care Law, or the UHC. Procurement and distribution of micronutrient supplies to LGUs will also continue. An advocacy and communication plan will be developed to help advocate to local government units to invest on additional micronutrients to ensure intake of these nutrient supplements by at least 90% of the target eligible population. It will also target beneficiaries and parents and caregivers to take the recommended dosage and number of micronutrient supplements. The program will continuously be monitored and evaluated through the Field Health Services Information System, or the FHSIS, and conduct annual program implementation review. The Tutok Kainan is also my agency's COVID-19 response, and it's being implemented now to monitor and evaluate an integrated nutrition program that helps ensure delivery of complementary early childhood care and development services in the first 1,000 days pursuant to RA 11148 or the Kalusugan at Nutrisyon ng Magnanay Act. Tutok Kainan's objective is to contribute to the prevention of stunting among children 0 to 23 months old by improving the quality and the quantity of food and nutrient intakes, as well as the utilization of related PCCD F1A services among the nutritionally at-risk pregnant women and children 6 to 23 months old in the target Tutok Kainan program areas. It also aims to provide additional food to pregnant women for 90 calendar days and complementary food for children 6 to 23 months for 180 calendar days, with priority to those who are nutritionally at risk or undernourished. The project components of the Tutukain supplementation program include the following. First, on social preparation activities. Now, this includes master listing, the signing of memorandum of understanding with local government units, LGUs, or the signing of memorandum of undertaking and marketing agreements with the Regional Department of Agrarian Reform or the DAR, as well as the Agrarian Reform beneficiary organizations, and orientation to local chief executives and health workers and also the beneficiaries of the Tutokainan program. Second component is on dietary supplementation. This program actually involves the giving of supplementary food to pregnant women, as I've said, for 90 calendar days during their last trimester of pregnancy, and to 6 to 23 months old children for 6 months. The third component is on nutrition education. This is actually the implementation of the program, which is complemented by text blasting or the nutrition text, as well as mother's classes using the Hydroposinane learning module in the first 1,000 days, which is also to be conducted in some areas subject to quarantine restrictions. The said module guides the mother participants to examine their existing feeding and caring behaviors for them to identify which of these practices can be retained, improved, or changed. And the fourth component is on community and home food production. Actually, in coordination with the local agriculturist office, the program provides families with access to services and commodities for the establishment of their community or home food gardens as ready and steady source of nutritious foods. Lastly, the fifth component is on SMS reporting. Local health workers report real-time accomplishment through short messaging system messaging that are sent or SMS messages that are sent to the Tutokainan reporting system. Overall, we can see that the support and cooperation of the local government units are needed to make the Tutokainan program successful. The food items for Tutokainan are procured from a mix of sources with preference for FNRI technology adapters when available, or other nutritious food formulations served in combination with locally available food. For the pregnant women, Nutriban is used for the first month and partnered with a lipid-based nutrient supplement small quantity, or what we call the LNSSQ in the last month. They are distributed with iron fortified rice and banyan in the second month. For the preparation of meals, ingredients, fresh produce are procured from the Agrarian Reform Beneficiaries Organizations, or what we call the ARBOs, as well as from small farmers groups at the LGU level. These fresh food items are used to prepare healthy recipes for the pregnant women and children 6 to 23 months old, consistent with the NNC approved cycle meal for the program. Tutokainan supplementation program has actually 4 phases based on budget allocation. Phase 1 is ongoing, which provides dietary supplementations for pregnant women in 7 HDPRC provinces, 1 city, selected LGUs in NCR, and provinces affected by typhoons Rolly and Ulysses in 2020. Phases 2 and 3 will be for supplemental complementary feeding for stunted and wasted 6 to 23 months old children, and phase 4 for pregnant women. Now, shown on the slide are the phases as well as the number of beneficiaries, number of provinces and municipalities, as well as the budget for each phase. The program currently has 5 phases. Phase 1 is further subdivided into 2 sub-phases. Phase 1A targets 24,300 nutritionally at-risk pregnant women from 9 provinces that are considered human development and poverty reduction cluster areas, which are areas with high prevalence of stunting, high prevalence of teenage pregnancy, and high magnitude of poverty. This also includes areas with high COVID-19 cases, Now, on the other hand, Phase 1B covers 7,175 pregnant women in provinces that were greatly affected by typhoons Rolly and Ulysses in 2020. Phase 2 involved the supplementary feeding or complementary feeding of 10,650 children 6 to 23 months old in 9 provinces. Phases 3 and 4 covers 13,113 children 6 to 23 months old in 22 provinces, as well as 15,500 children in 16 provinces, respectively. My agency, the National Nutrition Council, also coordinated with DOH to incorporate the dietary supplementation program among pregnant women and children 6 to 23 months old in the Department of Health's Devolution Transition Plan. The DOH DTP, which includes the Tutok Kainan program, has already been approved by the Department of Budget and Management. In the NNC's Devolution Transition Plan, there will be gradual devolution of the program in 164 selected 5th to 6th class municipalities and 30 other municipalities hit by typhoon death in 29 provinces in 2022 and in 2023, with 100% funding from the NNC for food commodities, administrative costs, and nutrition text messaging for 2022. This is actually Tutok Kainan's Phase 5. Now, upon evaluation of these areas, those that are seen to be not ready for full devolution will still receive 50% funding from NNC in 2023. By 2024, these areas should be fully devolved. As for other areas not funded by the NNC, these should be fully devolved starting 2022. The NNC central and regional offices will continue to conduct various advocacy activities with LGUs and other stakeholders to encourage them to fund the program or actually provide any form of technical assistance. Here are some recent photos of the implementation which was taken this January of 2022. Shown are our hardworking nutrition workers in Cagayan and Isabela, as well as pregnant women beneficiaries who received their half meal allocations. One of the commitments actually of the National Nutrition Council for the Enhanced Partnership Against Hunger and Poverty, or the IPAHAP, is to take into consideration partnerships with community-based organizations through the utilization of a negotiated procurement community participation for food commodities. We are glad to say that currently we have actually 37 signed marketing agreements with agrarian reform beneficiary organizations, or the ARCOs, who supply steadily ingredients for hot meals such as vegetables, root crops, meat, fish, and others. We have disbursed actually 17 million as payment to these ARCOs, and processing of payments is also ongoing. We are also glad to be one of the supporters of the DOST FNR's technologies by procuring commodities that they have developed, such as the Nutripan, the rice mango blend, the rice mango sesame, and the Milgo from FNRI technology adapters. At this point, I can say that the DK program, or the Tutok Kainan program, can be a model for the LGUs to adopt as a response to the effects of COVID-19 in the nutritional status of children. Now, time and again at the government sector, we continued to implement the infant and young child feeding program, and this is considered as a mitigating action to COVID-19 effects. Its outcome objectives is to have an increased prevalence of exclusive breastfeeding up to 6 months and the provision of complementary foods 6 months with continued breastfeeding up to 2 years and beyond. Infant and young child feeding, or IYCF, refers to the advocacy, protection, and support of safe and optimal feeding for infants and young children. This includes the promotion and protection of breastfeeding, protection of non-breastfeed infants by minimizing the risk of artificial feeding, as well as practicing appropriate complementary feeding. Results of the 2019 expanded National Nutrition Survey of the DOST FNRI revealed that we were able to exceed our target for exclusive breastfeeding at 35.1%. Regrettably, we are way below our target for 6 to 23 months old, meeting the minimum acceptable diet or the minimum diet diversity and meal frequency. The IYCF program aims to improve the practice of exclusive breastfeeding and complementary feeding by building and sustaining an enabling environment in various settings. Hence, IYCF continued to focus on the following key strategies for 2021 to 2022. First, health system support. These targets increasing the number of hospitals accredited as mother and baby friendly with trained personnel on the care of small babies. Second, community-based health and nutrition support reach targets, increasing number of nutrition counselors trained on complementary feeding, relief feeding, and etc. And B, setting up more functional milk banks. Third, increasing the number of municipalities in PPAN-focused provinces with established or pool of trained mothers, support groups, and peer counselors in IYCF. And lastly, increasing the number of barangays with functional community-based support groups on IYCF. Third strategy was on maternal protection and improving capacities of workplaces on breastfeeding. This particular strategy aims that all regional tripartite industrial peace councils adopt a resolution advocating or in support of breastfeeding and lactation policy, and that all NNC governing board member agencies implement the civil service DOLE issuance on RA 128 or the Expanded Breastfeeding Promotion Act of 2009. Third is, another strategy is the enforcement of the Executive Order number 51 or otherwise known as the Milk Code through the Regional Interagency Task Forces EO 51 and RA 128. And lastly, for 2021 to 2022, the DOH is conducting an essential maternal newborn care and lactation management training of trainers, harmonized maternal newborn child health and nutrition training, and mother-baby friendly hospital initiative milk training, as well as the Milk Code Task Force training. The government could only promote good nutrition to inform the public of good nutrition for their children using different platforms. Now, aside from the social media, TV and print, we can reach more clients, especially those in rural areas, using radio network during COVID-19 pandemic. Now, for NNC, we were able to maximize the use of our very own Nutri-Escuela radio stations in various regions in the country to promote good nutrition, to address over and undernourished children and their families for taking care of their children. As a flagship program of NNC, we now have 50 NTC licensed community radio stations spread out in the country with 100 or 300 watts transmitter power established as early as 2008, with each radio having 30 to 35 kilometer radio signal reach depending on the terrain. We are currently reaching 1,923 barangays or about 2.1 million listeners, which excludes listenership via online streaming. In the management of the Nutri-Escuela radio stations, we have a strong partnership not only with the national government agencies and local government agencies, but also with the state universities and colleges. As you can see in the slide, I can show you some examples like the Radyo Kausbagan, DYNGF at 103.1 MHz in Palawan, Leyte, established in partnership with Palawan Institute of Technology. We have another one in Bongao, Tawi-Tawi, which is also known as Radyo Pasanangan or DXNH FM 94.1 MHz in Bar. In Region 1, we have Radyo Kailian, DZNF-FM 97.3 MHz, supported and managed by the Ilocos Sur Polytechnic State College of Santa Maria, Ilocos Sur. Now with it, we can show that we can reach people with the right information to correct their nutrition and health practices, as well as provide them with updated information on programs and projects, and while we maintain COVID-19 restrictions. In social media, government can also maximize its use in disseminating information on nutrition and health practices and in taking care of their children. The National Nutrition Council, for one, continues to develop social media cards, and these are posted in NNC Facebook pages of the NNC central offices and those of the NNC regional offices. Before I end this presentation, let me read the statement from the Global Nutrition Reports and the World Bank Group. Malnutrition is a threat multiplier. If no action is taken, the effects of current COVID-19 pandemic will only make it harder for vulnerable population to protect themselves against malnutrition. It is the reason why we must continue to work together, as even short-term disruptions could have irreversible effects on child survival, health and development, and long-term productivity. Being a multifaceted problem, malnutrition requires that we unify our public and private plans and efforts and use integrative and coherent approaches to solve this problem. We each of us serve as angels in giving the best protection for our children, shielding them from hunger and malnutrition. Maraming salamat at nutrisyong sapat para sa lahat.